please, the audience is eager to know how you can make this big surgery interventions with a lot of risk that the soft tissue and the aesthetics is gone afterwards. We are very happy to have you here, and the stage is yours. Thank you.
Well, Paul, thank you very much for your kind introduction. Well, to be successful in a grafting procedure, we should be able to react on different clinical situations, from a surgical, a technical, but especially from a biological point of view. Each clinical situation has its own biological demands. So we'd like to share in different clinical cases with you, starting with a trauma in the upper front. There was a root fracture, so we could not keep the tooth. So having a close look to the situation, there is a little missing papilla between the two natural teeth. So the idea is not to make it better than nature, but to keep the morphology from the very beginning. So in this specific case, there was no bone on the facial aspect. So we were thinking, how is it possible to predictably rebuild the missing bone on the stage of tooth extraction and to keep the morphology stable long term? And we ended up in a study of more than 50 extraction sockets having a missing buccal bone, using autogenous hard and soft tissue grafts to do the grafting, to rebuild the missing tissue, and we had a 5 years follow-up to find out, is it possible to keep the morphology stable long term? So once we do extract the tooth in the aesthetic zone, of course we have a huge responsibility, and we should never compromise in the aesthetic zone. So especially if we have a missing buccal bone, as in this case, we have to clearly think about the biological reaction of our body once we would do placing an implant immediately, or to place a graft in advance. To be successful in the grafting procedures and to avoid complications, of course we have to make sure to have a nice contact between the recipient side and the graft we place in. This is why this extraction socket is carefully cleaned, curated before now placing the graft. So in this nice young lady, we had a wisdom tooth, and we removed the wisdom tooth, and at the same time we did collect pure autogenous bone chips, and those bone chips were now used to fill up the extraction socket, to support the soft tissue, but especially to rebuild the missing facial bone. So there was a palatal bone, but there was no facial bone. So the bone graft is now filled up the socket according to the adjacent structures. So the idea was to keep the morphology. Of course we could be raising a flap, but finally we would destroy the natural morphology. So to not raising the flap, to not shift the mucogingival border, in those cases we decided to use a free gingival connected tissue graft from the palate. So according to the shape of the extraction socket, there was a free graft taken from the palate, which is now used to seal the extraction socket. So this soft tissue graft is containing epithelium, but also connective tissue. So to be successful in the grafting procedure and to avoid complications, we have to make sure not only to create a proper implant bone to recipient side contact, but also a soft tissue contact. We have to make sure to stabilize the free soft tissue graft to have a nice contact in between the recipient side and the graft itself. So by suturing these soft tissue grafts, we are able to create a stability, we are able to seal the grafted area, but especially, and this was the aim, to keep the contours. So 10 weeks after the grafting procedure, we can find a stable volumetric situation. But what about the missing bone? Let's have a look to the situation 10 weeks after the grafting process. So this is now the stage of implant placement 10 weeks after doing the grafting process, and we can find a beautifully integrated bone graft, and very important to make this an aesthetic success, we do have the bone support for the soft tissue. This is a case I did more than 10 years ago. Of course, it would be a beautiful case for navigation. Those days we did not have navigation, so we did it freehand. But to avoid additional scar tissue, we were trying to not have any releasing incision, only opening the crestal area. Of course, we have to be very precise in the drilling process. We have to check whether there's a perforation or not, and this is why we use the simple probe to check the bony situation. But finally, we were able to place the implant into a proper implant prosthetic position, which is essential in the aesthetic zone to be successful. And we do have enough bone supporting the implant and the soft tissue. Those days we were using a 3.5 diameter ankylos, 40 millimeter in length. Of course, today we would maybe reducing the length of the implant. But what we have now is an implant being beautifully surrounded by a revitalized bone situation, enough support for the soft tissue to make this a long-term aesthetic success. So the biopsy from the grafted area, taken 10 weeks after the grafting process, shows us that large parts of the bone graft had already been revitalized, which is very important for long-term tissue stability. So the picture showing the clinical situation 5 years after the implant prosthetic situation still shows a very stable clinical situation. But what about the radiograph? Well, within the years, the free graft became more stable, more visible because of an increased remineralization. But it's also that the stable implant design also positively influenced the surrounding implant tissue. And it's even more obvious on the cone beam CT made 7 years after the implant prosthetic restoration. We can find a very stable, very dense mandibular structure supporting the facial aspect of this implant. By using autogenous hard and soft tissue grafts, we are able to rebuild missing facial bone on the day of tooth extraction, and we are actually able to keep this morphology stable long term. Well, this case looks much more demanding from a clinical point of view, but from a biological point of view, in fact, this is quite an easy case, because the implant is positioned inside the contours. So all we have to do is to fill up the space in between the implant and the existing contours. How to make it simple? Well, we collect bone during the implant site preparation using this beautiful Dentsply tree fine. So by making the implant site preparation, we collect the bone core and we collect bone chips, all coming from the same area. And finally, we are able to rebuild the missing tissue volume by bone coming from the implant site itself. So by using this simple technique, we are able to actually rebuild the missing tissue volume to increase the soft tissue support, to support the soft tissue itself, to create the natural morphology, to create the natural convexity we would be expecting around a natural tooth. The next case, from a biological point of view, is much more demanding. It's because we have missing contours. We have missing contours buccally and palatally. So to be successful in this case, we first of all have to rebuild the contours by using this special, going back again, using the special bone core technique, the bone membrane technique, and creating a very stable biological space in between the recipient side and the graft itself. So how is it possible to create these bone membranes? Very often, in fact, we have a combination of different surgeries, like here, removing a wisdom tooth and creating a bone grafting procedure, I would like to share a video with you showing how to remove a wisdom tooth and how to create these bone membranes. And there's a beautiful instrument from Dentsply which is called the micro saw, which is a diamond-tipped saw. An instrument with an amazing penetration power. It very smoothly cuts the bone, but very important, it only very superficially cuts the bone. So we're not going deep into the bone. All we create are fracture lines. So the idea is to have osteotomies which are slightly overlapping, to create a fracture line, to make it possible to luxate this bone graft to the buccal. We have a very thin disc, so we can extremely precisely cut the bone. So to finalize the preparation, we make little perforations from the crestal, again only very superficial. Finally, using a chisel to luxate the bone graft to the buccal. So remember, there was a wisdom tooth impacted in the bone, and instead of removing the bone with a large drill, we are collecting the bone. And you can see the very superficial osteotomies coming from the microsaw. But now after removing this bone, we have a beautiful access to the wisdom tooth. We are easily able to now remove it, but still having the bone graft left. So very often we are able to combining those procedures with the grafting procedures. So the beautiful options with a microsaw is in fact the very thin disc, so we can very precisely cut the bone. We can even split this bone block into two thin bone membranes, coming finally to the stage of this biological concept in using thin bone blocks in combination with bone chips. So the instrument doesn't only allow us to very precisely and safely harvest bone, but extremely precisely cut the osteotomies. Well, sometimes we only use one bone membrane, so there's one bone membrane left. So what to do with it? Just place it back again. So in these sick indications, we were able to remove a wisdom tooth, to create a bone graft, to create, well, a bone membrane, and additionally not creating a defect in the donor side. So there are so many options in using the microsaw. So the microsaw is offering us a very precise but especially safe possibility to harvest bone from the retromolar area. So coming back to the case which I started with, we had to rebuild bone in 3 dimensions. We had a vertical defect, so there was a palatal and a buccal bone membrane fixed to each other, creating a stable biological space and filling up this space with pure autogenous bone chips according to our biological concept. So in most of the cases, we are able to combine implant placement and the grafting procedure in the aesthetic zone. If you have a look to the situation 10 years after the implant restoration, we can still find a very stable clinical but also radiographic situation. But what about the lower front? Well, the lower front is one of the most demanding situations from a biological point of view because of the very limited biological space, limited space for placing an implant and to create new tissue. So especially in those cases where we have vertical defects and missing bone on the adjacent teeth, we actually go for a 2-stage procedure from a biological point of view to create enough contact to this little recipient site. So again, we are using the bone membrane technique, creating a new dimension laterally, creating a new vertical dimension, creating a stable biological space and fill it up with pure autogenous bone chips. So finally we are able to, well, get back the original bony contours. 3 months later, we can now place the implant into a proper implant prosthetic position. So by increasing the bone volume, by increasing the support for the soft tissue, we were significantly able to increase the soft tissue volume itself. And definitely, the Ankylos is one of the best implants in the aesthetic zone because we are able to create biological space, we are able to create space for the bone and for the soft tissue, for the papillas. So by increasing the tissue volume, by using the biological potential of this implant, we are able to rebuild the morphology and offer this patient a stable and predictable long-term aesthetic success. So the idea of the biological concept is based in using thin bone membranes in combination with bone chips. The idea is to increase, to accelerate the revitalization of this graft, to create new bone formation, to stimulate the cells and the blood vessels, to making this tissue being stable long-term. Another case, another vertical defect, and another problem. This patient, she is a vegetarian, and she denies any type of animal products. And I think also we as a surgeon should be very critical in the products we are offering our patient. And fortunately, Dentsply is offering us a huge range of different grafting materials to react on this specific situation. So in those situations, we love to use the algepore, which is in clinical use since 30 years now. It is of plant origin and therefore finds a huge acceptance, a great acceptance in our patients. It is a very porous structure. It stimulates the ingrowth of cells and of blood vessels. It has a huge osteoconductive potential, and it stimulates new bone formation. Of course, to be successful in a grafting procedure and to avoiding complications, we need to stabilize this grafting area. And due to the fact that she is a vegetarian and denied any animal products, we use this beautiful titanium membrane, which is beautifully able to be, shaped anatomically and stabilizing the graft, which is essential to be successful in a grafting procedure. So also, in this case, we were able to react on our specific needs, and after 3 months we can find the algepore particles being beautifully integrated and surrounded by new bone formation. So by using this type of, plant origin products, we find a great acceptance in our patients, and we are happy to offer our patients a solution for this specific indication, while offering this patient the natural morphology we would expecting around a natural tooth. But what if we have tissue missing in 3 dimensions? What if we have missing tissue vertically and naturally? Well, in those indications, we like to combine hard and soft tissue grafting using the biological concept with thin bone membranes and bone chips, but combine it with the so-called subepithelial connective tissue flap from the palate. Of course, to be successful and to avoiding complications, first of all, we need to rebuild the missing contours. And as seen in this case, where we do have a missing buccal bone and palatal bone, it is essential to rebuild it vertically first. And for this reason, we have again 2 bone membranes, one buccal and one palatal, and those bone membranes are now fixed to each other, creating a stable and protective framework. So we use a long screw from the buckle and pick up the pellets of bone membrane. The screw has a length of about 12 or 14 millimeters. So by using this bone membrane technique, we are able to create a very stable biological space, a well-protected area, which is finally filled up with pure autogenous bone chips, all coming from the same donor site.
So we see the new buckle wall.
So we can actually also, imitate the natural morphology in a sense of convexity. These are the bone chips coming from the same donor site, and now we are able to fill up this gap and to complete the missing bone. But what about the soft tissue management, which is very essential in this very, sensible aesthetic area? Well, first of all, we want to protect the grafted area, but additionally we want to increase the soft tissue volume.
Making it possible to place the implants into the ideal implant prosthetic position.
So to increase the tissue in all 3 dimensions, we very often use the connected tissue from the pellet. But in fact, we modified the technique in a way that we do not talk about a free connected tissue graft, we talk about a pedicled subepithelial connected tissue flap. So the soft tissue is still pedicled to the pellet, meaning we are able to have a blood supply, increasing the prognosis of these grafting procedures, again trying to limit the risk of complications. But it's not only the blood supply which helps us to make it more predictable, it's also the fact that we can much better stabilize this tissue, which is essential for a proper integration of this soft tissue as well. So by using this flap, we are able to create a 2-layer closure, but we are also able to increase the soft tissue in 3 dimensions. We increase it vertically and laterally. Additionally, we are able to increase the keratinization in this area, the connection in between the bone and the soft tissue, so the symbiosis between both of them will help us to create more stability long term. Essential to be successful in a grafting procedure, of course, is also to create a hermetic soft tissue closure. So comparing the situation before and 3 months after the grafting procedure, we can find a much more favorable situation. And to place an implant into a proper implant prosthetic situation and position is essential to making this an aesthetic success. So by combining hard and soft tissue grafting, we are able to increase the tissue in 3 dimensions, making this a long-lasting, aesthetic-pleasing result for the patient. So we never compromise in the aesthetic zone. To summarize, how can we make a grafting procedure predictable? We have to respect biological rules. Each clinical situation has its own biological demands. So we have to be able to reacting on different clinical situations using different techniques, using different grafting materials. But once we are able to use the biological potential of our body and the biological potential of different grafting materials, we are able to offer our patients a predictable and especially pleasing long-term aesthetic result. Ending up my lecture with this final pictures, let me thank you very much for your kind attention. It's a great pleasure to share this.